Hello students, we are going to discuss about the basics of the action potential regarding the basic terminologies depolarization, repolarization and hyperpolarization. Most of you get confused in these words, but this is a very simple physics which applies here. So you all know that the membrane, it has two poles, means one side of the membrane is facing the intracellular fluid and the other one is facing the extracellular fluid. And we also know that even at rest there occurs a potential difference between the inside and the outside of the cell membrane. Now at rest there occurs a dipole. Hence it is this dipole which we refer to as the membrane potential, and or this state is also called as the polarized state of the membrane potential or the membrane. When we talk about depolarization, this means there is dipole reversal. Now this dipole reversal would occur when the intracellular fluid will become positive with respect to the extracellular fluid. Now this would happen whenever a positive ion is going to move inside. Now the two positive ions which result in the depolarization because of the influx, they are the sodium and the calcium. The sodium influx is seen during the depolarization of the nerve and the skeletal muscle and also the ventricular cardiac muscle. On the other hand, the calcium influx results in the depolarization in case of the pacemaker tissue, the plateau phase of the ventricular muscle and even the smooth muscles. The other method of depolarization is when the positive ion is not allowed to leave the cell. Now that happens when the leaky potassium channels, they are blocked, hence resulting in increased potassium concentration inside the cell, resulting in depolarization. This happens in the beta cells of pancreas, in many mechanoreceptors and chemoreceptors. The mechanoreceptors like the inner hair cells of the ear and the chemoreceptors like the glomus cells in the carotid bodies, they act through the same mechanism. Talking about the repolarization is when the dipole is maintained or restored, it is called as the repolarization. So here the positive ion is stopped from entering this cell and the excessive positivity is now moved out of the cell. This happens because of the blockage of the sodium influx that happens at the peak of the spike potential in the nerve, skeletal muscle and in the cardiac muscle. Or we can even have the blockage of the calcium influx as we see in the cardiac muscle or the smooth muscle. The potassium efflux begins during the phase of repolarization, and this is the main ion which causes the repolarization. So this happens in nerve, skeletal muscle and cardiac muscle. The hyperpolarization is a state when the negativity or the dipole becomes very strong. The intracellular fluid becomes more negative even than the resting membrane potential. Now this occurs because of the prolonged potassium efflux, because the potassium channels are slow to respond. With that, the resting membrane potential is restored. After hyperpolarization, the resting membrane potential is restored, one, by the sodium potassium ATPase pump, and also the increasing potassium efflux decreases the leakage of potassium from the cell to the extracellular fluid, and hence the resting membrane potential is restored, restoring the membrane polarity. So it is all about the dipole, as you can understand. Thank you.